All right, so next step in taking care of a trach patient is that we need to clean around that stoma. Remember, it's another orifice, so they have secretions that come out, and we need to clean and make sure that area is good and that skin has good integrity. So things that you are going to need for this is you're going to need, got a little saline bullet just to wetten our long Q-tip here. We need a new drain sponge because we want a clean one, and we'll change out trach ties while we're in here doing this. So what I'm going to do first is I'm going to talk to my patient and say, hey, Mr. Smith, I'm coming in. I'm going to clean around your trach a little bit, and we're going to pull out this old drain sponge, kind of look at it, make sure that there's nothing big, bad, and ugly in there. There might be some secretion, again, especially during cold and flu season, might have some yellow stuff there. All right, the other thing we're going to do is I'm going to now get my Q-tip, and this is not a sterile procedure, it's just a clean one. Okay, so we're going to get that a little moistened because just like you know with kids with snotty noses, it's way easier to wipe their faces with a little moisture on it than versus just trying to wipe it with a dry napkin. So we're going to go in here and we're going to clean, and we're going to clean from the inside out. So we're going to clean closest to the trachea and kind of out. And depending on how many secretions this patient has and how dried they are, it might take a couple Q-tips, and it might even take squirting a little bit of saline just right on that neck to get it good and clean. But you don't want to squirt it like down in there. So just always being careful. We're going to make sure it's nice and clean. The other thing we're going to do now is I'm going to call a friend in, and we're going to change out these trach ties. We never, never, never want to change trach ties without someone there, because if he coughs while we're taking these off, he could cough that trachea right out, and that would be not a good day for anyone, okay? So we're going to have this, and you can talk to him and make sure he's still doing okay. We're going to put these, they're nice and Velcroed. Now different facilities have different trach ties. I'm going to hold. Could you please put on that one? So you might see different ties as you go to different facilities. Then Ashley's going to pull that one out from behind. And we're going to kind of work together here, but one of us is always holding, and we're always communicating that we're holding. Can you hold? Okay. And then we're going to put that on. And then we want to make sure we can get a finger down in there, a finger or two, depending on how fat-fingered you are. So make sure that there's a little wiggle room in there. Thank you very much. And then we're going to put in our new dressing. Now that our trach is secured, we can put in our new dressing. Now this gets tricky, especially depending how tight their trach is in there. So we're going to kind of wiggle it around to get it up. Sorry, I'm reaching over your face and you get to see the back side of my arm. And just again, always talking to your patient, making them feel comfortable, letting them know what you're doing until we're in there and we're nice and secure. And I might need to tighten it just a smidge because he kind of is plastic and seems to not be fitting it real great. So, all right, and that is how we do a dressing change or clean around there and change our trach ties.